It's time for Studio 7, sponsored by your Permian Basin Chevy dealers.
It's the art of dentistry. Dr. Rutherford.
Welcome back. If you or someone you know has dentures, or you think dentures might be in your future, well, this is for you. In today's Art of Dentistry, our friend Dr. Rutherford is here to show us what happens when you have dentures and when you should consider implants. Dr. Rutherford, thanks so much for being here
today.
Glad
to be here. Always enjoy it.
Yes. Okay, so first tell us what happens to your jawbone when your teeth are removed.
Yeah, the most important thing to know is that you start losing bone.
Okay.
The bone is only there to support the teeth. And so when the teeth go away, your body says, why do I waste the effort to keep the bone there? And so the bone starts to shrink away.
Okay.
It's kind of like if you don't use your muscles, like if you broke your arm or something, your muscles are weaker when you come out of the cast. But the difference is, with muscles, you can start working out again and build them back up.
Right.
But it's not that way with the bone. As the bone shrinks away, it's just gone.
Oh my
And
goodness.
so dentures, the way they fit in your mouth is by just sitting on the gums.
Okay.
They just sit, and just by the fact that they fit precisely to the shape of the gums with the bone underneath the gums, that's the fit. However, as the bone shrinks away, your dentures fit worse and worse.
Okay, they loosen.
It's kind of like if you lost 20 or 30 pounds and you're going like, how come my pants don't fit anymore? Well, the pants didn't change.
Well, that's
you
a good
shrank
problem
out
to
from
have,
under
though.
it. So your denture didn't change, but now the mouth, your gums and bone is shrinking out from under it.
I guess so dentures fit worse over time, like you said, when the bone starts to go away.
Right.
And so how do you fix that problem?
Well, let me just show you this first x-ray, and it shows you what I'm talking about. If you look on the lower right, our lower right, between those two back teeth, you can see how the gum and the bone actually kind of shrinks down. It's sort of a saddle shape.
Yes.
And it used to be just dead level in between those two teeth, but now it's way down to there.
Okay.
Now look on the lower left, behind the back tooth, the same thing has happened because this patient lost that back tooth.
Okay.
And so that's what happens. Now, this can go to the point, this is another patient of ours, and that little pencil-thin jawbone, yes, that white line in the front is how thick her bone is now.
Wow.
And so she comes to me and she says, I have dentures, and I have 4 sets of dentures, and 4 different dentists have made me dentures, and I can't wear them. What can you do for me?
Right.
And this is the reason that they don't fit anymore.
Okay.
But also, this is the reason now I can't even place implants, because there isn't enough bone even to place an implant in.
Wow.
And this person, you know, it's like literally a pencil thickness of her jaw. And so she could break her jaw if she bit down on a walnut or something, got bumped in the chin or something, you know, by a toddler, granddaughter or something.
Yeah, okay.
So now what we're going to be talking about is what can you do about it?
Right.
Not in her case, she is just stuck. But for most people,
Okay.
what you would do is a couple of implants.
Okay.
Implants are set in the bone, kind of like the root of a tooth sets in the bone. And this first photo just shows a plastic model showing a couple of implants, and they have a little ball top that the denture snaps onto.
Okay.
And the next photo just shows what the denture looks like underneath. It has a couple of little snaps.
Okay.
Okay, and the next photo, that shows with 2, and this shows with 4. 2 in the front and 2 more towards the back.
Okay.
And that just makes your denture more solid.
So it keeps
It's
them in
really,
place.
yeah, it's really in place good. Now, you can take them in and out yourself.
Okay.
But instead of them just flopping up and down. So this is a huge improvement. 20 or 30 years ago, we did not have implants to offer you. And so if you have dentures, then you're just stuck with just trying to glue them in with denture adhesive. But you know, when that begins to fail because you have less and less jawbone, then implants are the key.
Okay, and so this will kind of solve your problem?
Yes.
Okay,
And
definitely.
that's something that we do every day. I placed 5 implants on 2 different patients Monday, and 4 of them were this exact scenario.
Wow, and so it just helps your patients feel more comfortable and at ease with their dentures.
That's right. It's pretty hard to eat if your denture is flopping up
Yeah.
and down and moving around and things like that.
Okay, so and you have an example to show us today, right?
Yeah, here's the actual little model that I have there. And the denture, you actually have to try a little bit to get the denture off because it snaps on.
Snaps into place. Wow.
So if you have dentures, you know, wow, that's a whole lot better than what I've got going on. I need to get implants. Call Dr. Rutherford.
Yeah, definitely. And dentures, they're a normal thing. A lot of people have them, right? So you shouldn't be embarrassed by this.
Oh yeah, there's millions of people that have dentures that have lost their teeth. I guess one of my points is don't lose your teeth. Do everything you can to keep your teeth healthy and keep them for a lifetime. And even that first x-ray I showed you where it looked like the bone was beginning to shrink away in certain places between teeth where they had lost, get implants, replace those teeth. You don't want to lose your teeth. But if you are in that situation, then implants can be the solution.
Okay, well, Dr. Rutherford, always great tips and advice when you come. We appreciate you being here.
I like to be here.
It's the art of dentistry.